to see all of you. I've missed you. And during these trying times, there's never been more important for us to get together and to learn from each other and figure out ways we can work even closer to serve those seniors in our community in these trying times. I want to recognize we have Liz Olson on with us from Spotlight, Liz, and Robin Valentine's able to join us today. And we're co-hosting today with my friend George Phillips. He's with Just in Time Moving and Storage, and they provide a wonderful service. George, you want to tell us just a little about what you guys do?
Yeah, we do a lot of local and long distance moving. We're down in the Tucson area quite a bit. We cover the whole state, so we do moving on a dedicated truck with a dedicated crew. And for those assisted living homes that are still admitting people currently right now, we're still going in there, masked up, gloved, gowned, partitioning off the areas for us to move people safely into and out of the assisted living homes. So that's kind of what we do. So thank you for letting me join you today, Kyle.
Oh, well, thank you. I couldn't do it without George. He's more technical than I am, and he's introducing me to Zoom, teaching me how to do this. So we're grateful to George. So we do want to hear from a few different speakers today. First, we want to hear from AMR, American Medical Response. We're very happy to have with us James Stoltenberg and Kelly Rentschler. James? Kelly?
Good morning, everyone. James Stoltenberg here with AMR. Just kind of give you a little background on me real quick. I just started 2 weeks ago, just almost 3 weeks ago now this Friday, as the new operations manager here in Southern Arizona. I come from a background of 27 years in the fire service and retired from Rural Metro Fire Department as a battalion chief. Throughout my career, I have been an operations chief, a training chief, TRT, hazmat specialist. I teach for the state of Arizona in incident command and hazmat. So kind of a very broad background. The last 3 weeks have been extremely challenging for me walking into this position. My support between Kelly Rentschler and Jacqueline Evans, who is our regional director for AMR here locally and Arizona Lifeline, have kind of brought me up to speed. And Kelly wrote me into this morning and asked me if I would do it, and I was extremely happy to do it and kind of introduce myself to the group and tell you a little bit about what we are doing here in Southern Arizona to take care of our paramedics, EMTs, communications, and our staff that are pretty much essential to keep this operation going on a day-to-day basis. The COVID kind of I don't want to say caught us off guard, but it has really been a challenge to get caught up. So our first and foremost priority has been taking care of our crews going into folks' homes, care facilities, businesses, wherever our ambulances respond to. N95s has been a challenge. We've been working closely with the CDC. To kind of tell you how close we work with the CDC, our NATCOM, which is our major incident command center that's out of Dallas, Texas, actually has a person from the CDC sitting in our incident command center, assisting us, helping us, taking best practices from what we're using out in the field and putting that out and pushing it out to everyone. So it's a great partnership, and it shows within our field. So currently, with the calls start at our communication center. So when they first come into our communication center, the first thing we do is we find out what's going on, and then added into our dispatch questions are kind of a COVID related questions, such as, is the patient having difficulty breathing? Do they have a fever? And do they have any type of cough going on? If they answer yes to any of those three, we suspect COVID. We relay that information to our crews after dispatch while they're en route. From there, the crews, once they arrive on scene, they go ahead and put either a surgical mask or N95 on based on the call type, glasses, gloves, and a medical gown, and they go in protected. They ask the same questions again while doing their questioning of our patient. And from there, they can make a good determination what type of call this is. Is this just truly a sick person, or is this suspected COVID? Some cases we go in and they tell us right away, I have tested positive for COVID, which then at that point, if they're highly suspected or they are, we go ahead and put a surgical mask on them if they don't have one, and then we start our treatments. So from there, it's not treated really any other way differently once we transport the patient. The one thing that we do is whatever receiving facility that we're taking the patient to, we do advise them that it is either suspected or a positive COVID case. That kind of changes up how we get to the ER. So once we get to the ERs, if it is highly suspected or a positive COVID patient, from there we then meet the teams outside. They will put something over the patient to help protect them a little bit more. And then we, once again, nothing really changes. We're still providing that patient care, both us and the hospital. We just kind of change our practices before bringing them into the hospital. So with that, that's kind of what we're doing day to day. We're also, within taking care of our crews, we have posted medical screenings that they can use a QR scanner on their phone, ask a couple questions before coming to work. From there, if they're good, they're allowed to come to work. If they have a cough or a fever, we do not allow them to come to work. We pay them for their time because they are sick, because at this point, if they get sick or have some type of COVID symptoms, we're taking care of the employee. We're not letting them lose pay over this issue right now. So it is presumptive at this point. We then send them through the medical screening process. We have a nurse line that they contact. They can do telemed with them. We also have, I want to give a really big shout out to Banner, Maine, who any of our employees who have the symptoms, Banner, Maine is providing tests to our employees for free to get them tested and screened. From there, if they either come back negative but still have symptoms, we are presumptive at that point in saying they have it. And we're taking care of them, giving them the time off that they need to heal, making sure that they have everything that they need. We have people that check on them to make sure that that employee has everything that they need. Because it's about a 2 to 3 week healing time process from the time they catch it to the time that they can come back to work. And then if they are positive, it's the same thing. We're not treating it any different. They're doing follow-ups with our OCMED. So right now, it's about taking care of the employees at that point after they get it. And then we have our other facilities. Our communication center is wearing masks. They have a screening process before they come in. I want to say they're pretty much on lockdown. We don't allow anyone else into that comm center because the communication center is the heart of everything that we do. Without them, we can't get the calls. We can't dispatch the calls. So we're making sure that they stay extremely healthy and not bring anything into that communication center. And then our support staff, our fleet services, and our warehouse folks are wearing masks, constantly cleaning hands. Equipment that comes in and out, we make sure it's decon prior to coming into the building. So we're just pretty much taking care of everything that we need to take care of to keep our operation going 24 hours a day, 7 days a week.
Hey, Kyle, one other thing that I wanted to add on with all this, or everybody that's on the call, not only does COVID affect us at a local level in the transports that we're doing and moving these patients safely right now. In addition, like James had mentioned, not only do we have our NATCOM in the Dallas area, American Medical Response, being the partner of Global Medical Response as the big brother, we actually hold the FEMA contract nationwide. So in addition to our local efforts, we actually, I think right now we have approximately 9 employees with another about a dozen on hold that we have shipped out. We had employees in the California market that came home a week ago. They were out there just shy of 4 weeks. We have crews out in the New York area, and we recently, over the weekend, deployed to New Jersey. So like I said, in addition to the local efforts, we also have our own employees going out on a national level under the FEMA contract. So that's huge for us as well, to make sure that not only helping local, that we're helping nationally to get these patients moved.
Wow, thank you so much. Are you guys, do you have more to share with us, or is that the end of your presentation?
No, sir. If there's anybody that has any questions, thank you for allowing us to kind of come on this morning and let James talk about what we're doing and how it's affecting us. And then if anybody has any questions, if anybody's in a facility that they're coming down with COVID patients, let us know how we can help. If there's anything that we can do, if we can be on the forefront in the beginning, it definitely helps with the transition later on.
Great. So
Yes, thank you very much for allowing us.
Oh, thank you guys. So yeah,
Kyle,
any questions, just unmute yourself and go ahead and ask your question. Yes.
can you send a follow-up email with their information so people can share it somehow?
With their information. We're recording,
Yes.
so hopefully we'll be able to on the recording, the audio and visual or both. But yeah, we can. You mean their contact information? I'm not sure what you mean.
Yeah.
I was gonna say, if they go in there, the chat box, they can also put it in there as well to everybody.
We are adding a chat, James's email to the chat right now.
Awesome.
For you guys.
Cool.
Great.
Thank you.
Any other questions? Just unmute yourself and go ahead. We want to make sure everybody gets an opportunity to ask their questions. Okay. Next, we want to put the spotlight on the Encompass Health and Rehabilitation Hospital. I'm very happy to have Kimberly and Jessica with us. Kimberly.
Hi, so Jessica and I are here, and we did have a PowerPoint, so I'm going to go ahead and let Jessica kind of go over the first few slides, and then I will join in.
All right. And can everyone see the shared screen or not yet?
I can, yes.
Okay. Okay.
And Jessica, are you on, or are you on mute? I don't hear you.
Okay, can everybody hear me now?
Yep.
Yep.
Okay, awesome. So yes, I am Jessica. I am the marketing liaison for Encompass Health, actually for both locations since we are now a merged market. And so I'm just going to first start off telling you what we are all about. I know that most of you do know, but I'll just kind of touch base with what it is that we do at Encompass, and then I'll let Kimberly take over talking about what we're doing with this COVID pandemic right now. So first things first, on the first slide, I'm just going to talk about who is appropriate for our hospital. And so what we need is someone with a medical necessity. So that's stroke, brain injury, amputation, spinal cord injuries, etc. So these, we bring people who have a very intense traumatic life experience, and we bring them to us to help rehabilitate them, essentially. Next, usually they need to have a functional decline, and so our most appropriate patients for rehab typically have a functional decline. Essentially, they cannot function in their typical environment as they once used to. And then we also require that they can tolerate at least 3 hours of therapy broken up into a single day. And I know that Kimberly's going to touch base a little bit more on that because the CMS has actually relaxed those requirements because of the COVID virus. So after that, what we also require is needing to have at least 2 therapies, and that usually is physical therapy, occupational therapy, or speech therapy, and there usually needs to be 2 that the patient is needing before they come to us. And not everybody needs all three, but we usually require that they need at least 2 of these therapies we offer at our hospital. Then on to the next slide. So we are a hospital, and so we offer this comprehensive program where we provide 15 hours of therapy a week, which is kind of intense for these people who've had these traumatic life experiences, totally rock their world. And to, ask of them to be able to do 15 hours of therapy in a week is quite intense, but we know the human body, and we know that they are capable, and we try to be as supportive as we can to make that happen for each of our patients that come here. Then our patients actually are seen by hospitalists and our rehab physiatrists. And what's nice is that these physicians see these patients face to face at least 3 times a week, or some of our doctors see their patients every single day. And so it's pretty incredible that these patients are working so closely with our doctors to be in constant contact and communication, so that they are seeking the best help, and these doctors are just there for them 24/7. And what's also nice is that since we are a hospital, we offer 24-hour nursing. We have these nurses on site for our patients 24/7. And it's also great because these nurses actually have a smaller patient-to-nurse ratio than an average hospital. And so with these people with these very high needs that come to our hospital, our nurses can care for them so much quicker and more appropriately than maybe what you get at an average hospital. So on to the next slide. What's kind of nice is that every patient has a care plan that is individualized and customized for them when they come here. We have this interdisciplinary team that includes these rehab nurses who are trained in rehabilitation nursing. We have case managers who work very closely with the patients and their family members. For those who are not able to communicate, who do come to the hospital, their family members are very involved to help facilitate their rehab course or what it is that they can do to help their family members in this time of need. We also have rehab therapists with their specialized training. And then we do offer family education and caregiving training, which is also pretty great, that we are allowing family members to come and learn how to help facilitate their family member or loved one in this time of need, and then to go home with them and to be able to keep facilitating life with them and helping them and aiding them and maybe encouraging them through their therapies still at home. And then we have this great procedure right now where we have this thing called weekly team conference, and the patients, what they do for these patients is that they have these teams who come together and talk about the patient's progress and evaluate their goals and their status, where they're at with their goals. And they try to progress towards these outcomes and any modifications to their treatment plan that while they're here, what it is that they maybe need to change in therapy, or what it is maybe more so that that person needs, or lessen. It's kind of great. So these people come together at least twice, either once or twice a week. I'll touch base back on that one, but at least once or twice a week, where they come together and all these people who have been involved in this one person's rehab, time with us, they're all talking about what it is that this patient is doing, how they're progressing, how they're regressing, what maybe more so they can do for them. And so it's a pretty great plan that they have laid out for these patients that come to us, and it's individualized for every single one of them. So enough about what it is who we are and what we typically do and what we focus on. I'll hand it over to Kimberly Moses, and she'll kind of talk about the COVID standards and what we're going with right now.
Thanks, Jessica. So can you hear me, Jessica?
Yeah.
Okay, perfect. So I think the main topic right now, obviously on everyone's mind, is COVID and how, as a hospital, are we accepting COVID positive patients? And we are not accepting COVID positive patients for initial treatment. However, we are accepting those who have recovered from COVID that have been hospitalized. And there are some criteria that has to be met first. They have to have 2 negative tests within 24 hours apart to make sure that they have finished their course of COVID. They also have to be fever-free for 3 days, and they can't use any ibuprofen or acetaminophen. So that's really important that they're fever-free. And the minimum time from the onset of symptoms would be 7 days, but most likely from courses that we've seen is typically 2 to 3 weeks before someone's ready to actually enter a rehabilitation phase from the COVID. And also the other thing I wanted to mention is that COVID is not a diagnosis in itself, but there's going to be some sequelae that come with that do qualify for coming to our hospital. So go ahead and to the next slide. So this is just some information on how COVID-19 works. It doesn't just affect lungs. It causes this inflammatory storm of the cytokines, and that's a enhanced immune response, and it can actually attack every single organ in the body, including the brain, the muscles, and nerves. And that's kind of what we focus on: the brains, muscles, and nerves. A lot of time when people are in the hospital, their other major organs shut down, and then having to stay on a ventilator for longer periods of time. It causes muscle problems, cognitive problems, and nerve degeneration. So there's a good proportion of COVID-19 patients who will need rehabilitation to get back to where they were prior. So just for your knowledge, any patient who's been in ICU for more than 5 days are very likely to have physical, cognitive, and behavioral problems. That goes for any ICU patient, not just a COVID patient. And then 70 to 100% of COVID-19 ICU survivors will have significant problems with cognition, activities of daily living, which include memory, attention, concentration, problem solving, and those can all be addressed with speech therapy when they come to us afterwards. And also, just because of the crisis type nature, a lot of these deficits are missed by, they're just, they're getting them out of that intensive care, life threatening, and then they're just, sending them to the floor and then sending them home without really addressing those cognitive behavioral changes, the muscle weakness. So we really encourage people to ask the families and find out, do you see a decline from where they were? And that's how we can see the need for them to come to us. Otherwise, they could just go home and not get the care that they need. And patients who've been in the ICU for more than 5 days have a 50% chance of having a critical illness, neuropathy, or
Kimberly, are you still with us? Might need to sign out and sign back in again.
Yeah, I think I'm back.
Okay, there we go. Cool.
Okay, yeah, my computer kind of does strange things every once in a while. So, okay, I think we're ready to go to the next slide. Okay, and then, so I'm a clinical liaison, and we all that work for Encompass, most of us are RNs, or we're occupational therapy, respiratory therapy. We all have clinical knowledge, and we can evaluate patients to see if they can benefit for our hospital, and also decide which therapies they would need in conjunction with our admitting hospitalist and physiatrist. And of course, our goal is to have patients return home, so to go back to where they came from with their family and friends. Go ahead and so some of the other things that's nice to know is that normally patients have to require 3 hours and be able to participate in 3 hours of therapy a day. That therapy is broken up into 3 one-hour segments, so it's not all at once. But however, because of this COVID-19 crisis, CMS has given us the ability to treat patients who don't require quite that much. So we can kind of ramp them up and help them get through. So they have lightened our guidelines somewhat. However, they still have to qualify for that intensive rehabilitation. So that means that they have to have a medical need for a hospitalist or a doctor to oversee their whatever chronic illness or coexisting illness. And they must also have a functional decline so that they can actually make functional progress and improve. And our therapy teams and physicians assess patients for the therapy needs, and they develop that individualized schedule that Jessica was talking about before. And patients do still need those 2 types, like physical therapy and occupational therapy. That's probably the most common because occupational therapy is like for the activities of daily living. Physical therapy is more for walking and those types of mobility issues. Speech therapy is for speech impediments, but also for cognition and some other, to learn how to speak and how to get rid of those improve their memory and cognition, which I think is going to be really imperative for a lot of these patients. And then, of course, the duration of these therapies depends on their current status. So our typical average patient stay can be 10 to 14 days. Someone that has a significant brain injury, maybe 2 to 3 weeks. It just depends. Some people only need a short stay, of maybe 3 to 7 days. So it's very individualized. And those, like Jessica had mentioned, those are discussed on a weekly basis with those team meetings so that everyone's progressing and getting the most out of their time with us. And I'm not sure if there's another slide or not. Visitor policies. Yes. So this is another huge thing. As many of you are aware, especially if you work in the skilled nursing or assisted living, visitor policies have changed dramatically. For instance, all visitors are pretty much prohibited. And that's the same as at our facility to keep everyone safe. However, one family member or the primary caregiver can participate in a family teaching day where they come to Encompass and they meet with the physical therapists who are working with their loved one, and they actually have a training period where they understand how to help their loved one when they come home and how to keep up the good work that we've been doing while they're at Encompass. So that is the one exception, and that's limited to only 1 visitor or family member per patient. And we will screen them just like we screen any of our essential vendors or even our employees. We screen them on a daily basis as well to keep everyone safe. And then the last thing is that the visitor needs to be over the age of 18 or older. And some of the other things that we're doing, we're following all CDC guidelines. We're still providing the same therapies, and we are using the social distancing. So that means we might spread the therapies out so there's fewer people in the gym at any one time. We are very diligent. We make sure all equipment is cleaned well between each patient. In some situations, we still are doing some group therapy sessions, but the social distancing is in place. And I know that they're much smaller groups and much further spacing between them. And that's pretty much, I guess we still have one more slide. So as a liaison, we're available. We are fully staffed. We have not cut back any staff. We're expecting to be busier than ever with this crisis. And we can always on hand to answer questions or do an analysis of a patient if you have anyone you think might be appropriate. We still are 7 days a week. We have weekend liaisons, which I work every weekend. we have, we follow all of your facilities' preventive guidelines. We know that a lot of facilities, for instance, skilled nursing, assisted livings, they don't allow anyone there. So we do telephone interviews and assessments over the phone with the family members or their loved ones. So we are able to still do our assessments. And if you are allowing visitors, we can come and see the patient in person as CDC guidelines evolve. But right now, I believe we're focusing primarily on assessing by phone. And we'll keep monitoring the situation, and we will react as appropriately. And so any questions, we'd be happy to answer them. No questions?
Okay. So Kimberly, I think what we'll do is we'll go ahead, if you would like us to, we can put this PowerPoint presentation on our website, if you'd like that.
Okay, I'll check with our my business development, and I'll just make sure it's okay to put this. It should be fine. I think that's a great idea.
I'll wait for your okay then.
Okay.
So any questions for Kimberly or Jessica? All right. Well, next, we want to go ahead and put the spotlight on Mobile Mills of Southern Arizona and hear what they're doing right now. Jennifer is with us. Jennifer?
Hi, Kyle. Thanks so much for having us today. Roxana Mendoza, our program director, is also with us on the call, so I'll do a little bit of a handoff to her as well. So Mobile Meals of Southern Arizona remains busy and serving clients. As you might remember, we're a little different than other meal delivery services because we provide 2 freshly prepared meals Monday through Friday for our clients. Most of our clients are seniors or people with disabilities who, for whatever reason, are unable to shop and or prepare food for themselves. In the wake of COVID, I mean, COVID has really created a disruption for so many people, right? And for many adults who perhaps were a little more mobile or who relied on family and friends or who relied on eating out a little or more are finding themselves isolated and unable to prepare food, right? And so we have taken up the charge first to continue to, we are essential, so we're in business, we're continuing to enroll clients. So we want that word to be out there. Again, we serve most of Tucson, Sarita, and Green Valley. And so if you know of people who need a service like ours, please do refer them. And we do deliver to complexes and living facilities as well. So I know that some of the living facilities don't have meal preparation, or they do, but people opt in or not. So know if you have people who need meal delivery service, that is something we can do. So our meals are, we offer medically tailored diets that conform to medical needs, the client's medical needs. So we do a lot of diets that are cardiac, renal, diabetic. We also can accommodate special diets if people are, if they have texture issues, if they can't swallow, if they need food pureed, if they're having end-of-life issues, battling cancer on certain medications that just makes ingestion and digestion difficult. But then we also offer very general special diet or regular diet meals. So people can opt in to whatever level of service they really need. You know, sometimes someone's doctor will want them to be on a diabetic diet, but the patient will say, well, or the client will say, well, I don't want to be. So in that case, we do allow for clients to sign a diet waiver, and we work with their medical professionals and let them know that that is the case. So I think really what we wanted to let you know is that we are open and serving, receiving clients. We provide 2 meals daily, Monday through Friday, freshly prepared from 9 facilities. So people get warm meals ready to eat for lunch, and then they have the other one for dinner that same day. They both come at the same time. And if they want to reheat, they can do that in the evening. So that is what makes us unique. Our meals are not frozen, and they don't get drop shipped once a week or twice a week. And by doing that, we have volunteers who deliver. And by utilizing volunteers, we can do a wellness check daily. Now, our service has changed slightly in the sense that, during COVID-19 response, certainly our volunteers are dressed a little differently. People are wearing gloves and masks and this sort of thing. And we're transferring the food from the trays when we get to the client's house before we get to their door. We're transferring the food from the trays into delivery bags and then handing those delivery bags off at the door with the client, or leaving it, calling the client first, leaving it at the door if they're able to pick it up on their own. What we're not doing anymore, except for in very extenuating circumstances, is entering the home and placing the food out in order to limit any contamination or cross-contamination that would otherwise happen. But that's really the only significant way that our service has changed at this time. Roxana, would you like to add anything else for the group in terms of how to onboard clients and what's happening with our services right now?
I think you touched on everything. We're taking referrals. We're working with different home health care providers that will refer their clients to us, and that's how we've been getting a lot of our clients is based on the referrals that we're getting through the home health care people. So if you guys know anyone that needs our services, please don't hesitate to email or give us a call.
Mm-hmm. And we have a few minutes here before we need to jump off the call for 10 o'clock. So we're happy to open it up and answer any questions you have for the next few minutes.
Did you guys mention to everybody, this is Liz, how are you?
Hi, Liz.
Hi. I was really impressed when I came in to visit you guys and saw that you also provide food for fur babies and pets, and that you collect donations. That was something that was new to me. Can you kind of explain that to everybody in case we want to make donations?
So we do partner with Cody's Friends, and we also partner with the Diaper Bank to provide incontinence supplies for our clients. We work closely with Cody's Friends, so that's where the donations come in through. And the Diaper Bank, again, it's also a donation through the Diaper Bank to provide our clients. So it has to be active clients in order to be enrolled in these programs. But anything is all on our website for donations and such.
Great, thank you.
And just to reiterate what Roxana said, we're very careful about not leading with pet food and incontinence supplies, because it's really a value added for people who are in our meal delivery program. But otherwise, if you're not receiving meals, we don't offer pet food and incontinence supplies on their own.
Yeah, that makes sense. Thank you.
Mm-hmm. Any other questions?
Yeah. Any other questions? Just unmute yourself and ask your questions if you'd like. All right. Well, thank you, Jennifer and Roxanne. Thank you.
Thank you.
Yeah.
Thank you so much. Kyle, I have one other shout out, and that is, of course, that we're always looking to partner with additional facilities who can prepare food for us, either on a regular basis or on a temporary basis, in case, especially in an emergency like this, we see a disruption. So I know you have a lot of providers, members who are providers, assisted living facilities, and larger entities that prepare and serve food. So we actually do pay our providers. Of the 9, only 1 donates that service. So we actually do pay for meal preparation and enter into contracts. So if there's anyone on the call, or if you know another member that might be interested in developing a contractual relationship with Mobile Meals to prepare food for clients in the community, I'd love to have an offline discussion with you about that. Thank you.
Thank you.
Okay. So what we'd like to do now is give everybody an opportunity to express themselves. If there's any announcements or something that you think the group can benefit from, just unmute yourself and we'll take it one person at a time.
Kyle, it's Liz.
Hi, Liz.
I wasn't very good at my unmute button. So I have a question for Kimberly, if she's still with us, with Encompass. I know that because of COVID, a lot of our elective surgeries and so forth have been postponed. Is that gonna, do you think with the way things are going now that that's gonna continue? Or do you think, you know, we're gonna know more by the end of the month and they'll start treating, you know, non-elective people again?
Well, I'm sure that
Or elective people.
Yeah. Now, I honestly do not know when they would do that. I know it's very difficult for the hospitals. And that's going to be on a state-by-state basis. So that would be something the state government would have to do because that's a restriction right now. That's pretty much most governors have actually restricted that, which is a real problem for hospitals. We still have a lot of business, but you're right, all the elective knee surgeries and hip surgeries. So I would anticipate that will be brought back as capacity and as things change. But I have no idea.
Yeah, I drove by two testing places yesterday, and I'd like to take a picture of them and send them to my daughter because there's nobody there. My daughter lives in Boston, so we have these testing places and there's just nobody there.
It's pretty devastating for the hospitals, actually. They're losing a lot of revenue. So it's something I'm sure that's on everyone's minds, but no, I have no idea.
Yeah, yeah. Well, thank you. We'll just pray.
Mm-hmm.
I'm able to help people with anxiety and depression using Zoom, the telephone call, helping them on a daily basis break through depression and anxiety if anybody's interested in that. My name is Jim Toomey.
Hi everyone, it's Kenya. We are offering a free CEU on April 29th through Zoom on conflict management. We will also be offering another free CEU online on pet grief. So those are both free. We are also offering our bereavement support groups through online services. Additionally, we started educational bereavement services. They started yesterday. They are every Wednesday, 11 a.m. If anyone needs any more information, we are happy to provide that. We've been doing a lot of videos for the community on our Facebook pages, all of our social media. So if anyone's interested in talking about something, providing positive educational videos, short, please let me know. Thank you.
Hi, everyone. Morgan. Go for it.
Okay. Hi, I'm Nancy Winters. I'm with Legal Shield. Right now, our law firms are open. Many of you are members of Legal Shield. 4.4 million of our members are being served now all across North America. And with the pandemic, there's so many legal issues that arise. And I put a link in the chat. So if you need any assistance, it's just click on there. There's some valuable information about some legal concerns, either as an employee or employer or healthcare issues, all those type of things. And I put my direct phone numbers if anybody has any direct questions for me, but there's some good information at the link, and that's also linked to myself as well. Thank you. Be safe.
Thank you. This is Morgan from the Alzheimer's Association. I just wanted to give a shout out to Kenya and Harmony Hospice. They've just done an amazing job of transitioning a number of their services online and providing great classes. And letting folks know that the Alzheimer's Association is here as well. Our helpline is available 24/7 to families that need that service. We have telephonic support groups that are happening now, and education sessions online will be launching soon, as well as some really great tips for family caregivers and professional caregivers related to COVID-19 and dementia on our website.
Kyle?
Yes.
I just wanted to let people know that Rose and I are still able to help patients either over the phone or with the care homes and facilities that are accepting new patients. Also, I am a notary in case anybody needs that service. I'll do mobile notary for their clients with the banks being closed.
And this is Rose, and I just want to tell you that Twilight Wish is still helping people. We just did a donation over at Ben Brith for some food for their emergency kitchen. So we're still taking donations, and if anybody needs any bags of some things that we are putting together through SSA, Senior Support Alliance, we're going to have some goodie bags made up with a few of us members of things that got donated. Toilet paper being one of the items in the bag, and Visiting Angels has some items that they're putting in. Denise from Cigna Insurance has got some. Cindy from Reverse Mortgages has, I think, Girl Scout cookies she's putting in the bag. So if there's any facilities or places that you know that could use some of these goodie bags, we're going to be distributing them and leaving them at the door where they have where we don't have contact with people,
or that have donations,
or have any donations. Thank you.
Thanks, Rose. I heard that you did do that, and I'm on the board of Covenant House. This is Patty Martin, the sister house, and we'd love to have you guys too. Thank you so much for all you do.
It's our pleasure.
Anybody else? So I do want to let you know that we are preparing for our summer fall edition of Spotlight, and you can find our edition online. It is digital. We do have an app. So if you're speaking with family members over the phone and they're needing resources, refer them to the website, please. Also, I know a lot of facilities or communities right now are not doing tours. They cannot, and virtual tours are the thing. So for our advertisers, we can put those videos on our website for people to see, and we're happy to do that. So they would just go to Robin at spotlight.seniorservices.com. Right now, too, we are making it a little bit easier, affordable for people to advertise with us. I know things are a little tight right now, so for the first time in 20 years, we're going to a one-time printing rate. And Liz will have more information on that for you if you're interested in that option. Anybody else?
Oops. Hi.
Hi, Kristen.
Hi, my name is Kristen Henson. I'm a registered nurse with Senior Helpers in East Tucson. Just real quick, what we do, we specialize in in-home care. Particularly, we have training in dealing with, in treating and providing care for those with Alzheimer's and other dementias, and particularly also we have a Parkinson's specialty. Things that we do include companion care. We can provide sitter services. We can move people to and from facilities. We also perform wellness watches. Everything, of course, is tailored to the needs of the individual senior. And we seek to complement some of these awesome services that I've been seeing here. I mean, there's some really fantastic stuff out there, and we seek to complement that. If anybody's interested in finding out how we can complement that, I encourage you to give us a call. Our office number is 520-790-5824, or visit our Facebook page. We're Senior Helpers Tucson East, Tanque Verde on Facebook. Yeah, that's a little bit about us. I also want to let everyone know that we are conducting a senior supply drive. So if there are any facilities out there that you know of, or any individuals you know of that need toilet paper and toiletries and hygienic supplies, let us know. We have some that have been donated to us. Also some cards and letters of encouragement for seniors that might be going through some depression during this time of isolation. And also, if you wish to donate anything, if you have anything or know of anybody who wants to donate, we are making contact with some of the care homes in the area and providing them with some of these items. So again, if you want to find out more or have anything to donate, just give us a call or send us a message. Thank you.
Okay. Anybody else? We want to make sure everybody has an opportunity to express themselves or to share. All right. Well, it was wonderful seeing everybody. Please be safe. Let us know if there's something you think we can help with. And you can unmute everybody, George, and we can all say goodbye.
Thank you, everybody, for all you do. It's good to see you. I miss you guys.
Thank you.
Thank
you. You too, Liz. Thanks for having this.
Stay safe.
Thank you, Kyle.
Stay well.
Bye.
Bye, everybody.
Bye.
Take care.
Bye, everyone.
Bye.
That's good. No, it's not even over. Okay.
Hey, Kyle.